Hello, my name is Dr. Elizabeth Fisher, and I'm a pediatric psychologist and a behavioral feeding specialist. I'm here today to talk to you about the basics of behavioral feeding therapy. This discussion is meant to give you some basics about behavioral feeding therapy, so we're going to start by answering a few frequently asked questions. It might be good to start by defining the term behavioral therapy. Behavior therapy is a type of treatment that tries to understand behavior and feelings, or how behavior and feelings are learned. We then try to change negative behaviors into more desired behavior. By changing behavior, we can often change feelings. For example, when children are afraid of something, they may cry and scream to avoid it, like when you go to the pediatrician and get a shot. Behavior therapy would try to change the behavior, crying and screaming, to a more desired behavior like deep breathing and calming. As a child is able to calm and accept the shot, you may find that the child becomes less afraid over time. Behavior therapy is often conducted by psychologists and counselors, but it is at work in your everyday life. For example, Timeout is a type of intervention that was developed by behavior therapists, but many parents now use Timeout widely to change how their children behave. Such things as stickers or using small prizes as rewards is also a type of behavior therapy, like when you give an M&M to a child for going on the potty. Behavior therapy has been shown to be effective in treating a number of conditions, including anxiety, depression, disruptive behavior, or child noncompliance. Many parents want to know, what is behavioral feeding therapy? Behavioral feeding therapy is the use of behavioral interventions to treat feeding problems. Behavioral feeding therapies targets behaviors that are specifically seen at meal times. These interventions are focused on changing behaviors, interest, and participation in oral feeding. It works like this. The treatment providers and the family will set a goal for feeding, something like, let's see if we can have Johnny eat 5 more bites of food. The clinician will suggest an intervention. Let's try giving him a reward every time he takes a bite. The clinician will then show the family how to use this intervention and will ask the family to practice at home. The family may then work over time at practicing the intervention, and eventually they will report back to the clinician whether this has been helpful or not. They will then change the intervention depending on whether there's a new goal or whether they are working on the same goal. This is a very simple example of the way that behavioral feeding therapy can work. It's really important to know that behavioral feeding therapy is hard work. It asks the parents to change their own behaviors in order to change their child's behavior. It takes a lot of commitment from parents, and it takes a lot of hard work over time. You may be asked to change how you schedule your meal times, how you structure your environment, and how you interact with your child. Many parents want to know, what are behavioral feeding problems? Behavioral feeding problems are behavioral problems that occur during the course of a mealtime. That's the most basic definition. Behavioral feeding problems exist in most children because there is some medical or developmental reason why they are having difficulty eating. So it's really important that a child receive an in-depth medical and swallowing evaluation to find out whether there is indeed a problem there. Once a child has had an evaluation, we can determine what's the next step in treatment. Behavioral feeding problems, in most children, up to 80 or 90% of them are medical in nature. But over the course of time, as parents try to get their child to eat, negative interaction patterns develop and refusal behaviors develop. So what you get in about 60% of children is an overlay of behavioral problems on top of medical problems. And even when the medical problems have been solved, sometimes the behavioral problems stay. Therefore, we sometimes need to treat the behavioral problem in order to get the child to eat. We've talked about the fact that behavioral feeding problems can reflect an underlying medical or a swallowing problem. Because this is true, again, it is really important that your child be evaluated by physicians and swallowing specialists to make sure there's no problem that's preventing them from eating or feeding. Once a child has been thoroughly evaluated, we can then decide whether this is a problem of can't, in other words, there is a medical problem or a swallowing problem interfering, or won't, where the child just is refusing to eat or drink because of some unknown reason. Behavior therapy is most effective for treating the latter group, the children with more of a won't problem. Behavioral feeding therapy can be one small piece of the puzzle, or it can be the entire focus of treatment. For example, some kids may need help sitting in the high chair without tantruming so that their speech pathologist can work on their skills. Other children are medically and developmentally ready for weaning from a G-tube, and behavior therapy may be the entire focus of their treatment. Behavior therapy can be provided in co-treatment with other specialists like speech pathologists or occupational therapists, dietitians, or physicians. Rarely is behavioral feeding therapy effectively done in a community setting on the basis where just the therapist is in the room alone with the child. Most of the time, behavioral feeding therapists work in clinic or hospital settings where they have ready access to the child's medical team. You may wonder, what are the pros and cons of behavioral feeding therapy? It's really hard to answer that for any one child. Because behavior feeding therapy is so individually focused, you really need to look at the pros and cons for each individual child. Whenever a clinician recommends an intervention, it's important that you ask them to explain to you the pros and cons of the treatment that they're recommending. It is also important that you ask them questions at that time and let them explain to you their thoughts and their rationale behind why they are recommending the treatment. Ask them if there are any dangers or any long-term outcome information that you might need to know. All of this information will be helpful for you in deciding whether or not this is the right thing to do for your child. You may wonder, how long does behavior feeding therapy take? Again, this is a question that is really individually focused, and it really depends on the child's medical ability, the medical situation, developmental abilities, and skills. Some children may move very quickly through feeding therapy. Other children may take a very long time. As I stated before, progress can be up and down or fast and slow. It's all based on the individual needs of a specific child. So you may be wondering how to know when your child would benefit from behavioral feeding therapy. Well, what we find is that most children, up to 80 or 90% of the children that I see, have some kind of a medical or developmental or swallowing reason for their feeding problems. But the literature tells us that sometimes up to 60% of those kids also have behavioral problems associated with eating. So even though your child has a medical or a swallowing problem, their behavioral refusals, the way that they tell you that they're having problems eating, those refusals will need to be treated over time so that we can make them better through therapy and medical intervention. Therefore, we really like to use behavioral feeding therapy in conjunction with many other therapies. It's not an either-or question. Many children need all of the therapies, and that includes behavioral feeding therapy. A great example of this is a child who has really poor chewing skills, but they're so afraid of eating that they cry and scream whenever you try and feed them. If you can't feed them, you can't get them to improve their skills. If you can't get the food in their mouth, you can't teach them how to chew. So they hit a wall in therapy. A behavioral therapist can help you to get your child to accept the food so that their speech pathologist can teach them how to chew it. Over time, their fear will get better if we do this. Many parents ask me, how does behavior feeding therapy work? Well, behavioral feeding therapy will begin with a thorough assessment. Oftentimes by more than one discipline, we will find out what your child's medical history is, what their developmental situation is like, and what their feeding skills are like. We will then work with you to set up goals for treatment and to decide on the reasons why you want behavioral feeding therapy. We will set treatment goals that include long-term goals and short-term goals. We will then decide on interventions. You will return with your child for follow-up sessions. Oftentimes these sessions might be 30 or 40 minutes in length, and many times they will involve a meal. You may be in the room with a behavioral therapist or more than one therapist at a time, depending on the clinic or how the clinic works. The therapist will show you different interventions, will teach you how to use them, and ask you to practice them at home. You'll then return for follow-up sessions where you might show the therapist how this has worked or talk with them about the difficulties that you have had. The interventions may then be changed, or you might stay the same and keep working at home. Over time, you will decide when you have reached your goals and when it is time to stop treatment. A frequent question that we hear is, will behavior therapy cure my child? Again, this is a very difficult question to ask, and behavior therapy is often just one piece of a very large puzzle. Remember, there's nothing magical about behavior therapy, and it's very hard work. However, when applied correctly with the appropriate goals, behavior therapy has a very good track record of improving feeding in young children. You may also wonder, what if my child is not getting better with behavioral feeding therapy? If you have been working in behavioral feeding therapy for a while and you don't see any improvements, it's really important that you talk to your clinician about this. It might be that there's something else going on. You may need to go back for further evaluation, or you may need to look for other problems that might be interfering. Sometimes those problems are medical and have to do with your individual child. Other times those problems might have to do with things that are going on at home or in the community, or that might be preventing you from following through with therapy. In any event, an honest discussion with your clinician about your concerns is really important. So you might be wondering what a therapy session really looks like. Well, oftentimes we start by sitting down with the parent and asking them how their week has gone and whether the feeding has changed since we last saw them. The parents then tell us if there have been any changes or what's been happening at home. And then we may sit down with the child and actually do a feeding. Sometimes the parent is feeding their child, other times the therapist is feeding their child with the parent watching. By doing this, we can then practice interventions. Sometimes the therapist will create an intervention and will show it to the parent. Other times, the parent will be using an intervention they've previously learned, and the therapist will coach them along, maybe help them to make it better or more efficient. We will then watch to see how the child responds to that intervention and decide whether that's a good one to practice at home. For example, we might be feeding a child with a spoon who doesn't want to accept the spoon. A parent might hold up the spoon, the child might hit the spoon away. Most parents' instinct is to withdraw the spoon from the child, but that really encourages the child's refusal. As a therapist, I might coach the parent to hold the spoon up and keep it presented in a very neutral manner. We may do this until the child accepts the spoon, and then we might praise the child so that they have a good experience with their eating. When we're doing interventions, the goal setting is really important. It's important not to set a goal that's too hard for the child, because if I have the child eat something from a spoon that they can't handle, they will have a bad experience and they will most likely continue to refuse. So how you set the goals and how you choose the interventions is really important.
We need your help. We need your financial support. You can visit our website to learn more about our organization. We want you to know more about this. Please tell your friends about it. Please be our champion. We need to spread the word, and we're relying on you.